Okay, so we've got this really great experience for you all this Friday. We will have an interprofessional lab with the OTAs, the MOTs, and nursing. And during this lab, we are going to have you and nursing and the OTAs work together to help identify how to assess cognition and vision, and really consider the functional implications. So nursing will be administering and teaching you how to use the Snellen chart, which should not be unfamiliar to you, so it'll be nice review. And you will be demonstrating some sort of occupation-based cognitive screen. Now, this likely is not going to be a paper and pencil using the slums or the mocha or the short blessed, some of the assessments that you might have learned about in your readings or had for your worksheets, but something more functional and occupation based. You might be using your toolkit that you created from the MOTs, the toolkit that they created. But as you're going through this and working as a collaborative team, how do you, as the MOT and the OTA, teach nursing how to functionally assess these two very specific areas, which, when unaddressed, can lead to falls, can lead to other injuries or confusion for the client, or maybe some other mishaps for the client. So two areas that really need to be addressed across the team from the interprofessional perspective. So when you're considering that cognitive screen, one, make sure you're teaching the nurse based on the questions that they ask. They need to know the answer, because if we're asking questions but we don't actually know the answer, that's not a reliable screen, right? So it might be recalling precautions. So if they have sternal precautions or hip precautions or spinal precautions, if they need to wear a helmet when out of bed. So are they able to recall their precautions and then, without cues specifically, then follow those precautions? That might be a nice way to assess cognition. Can they consistently call to use the restroom? Are they consistently calling the nurse for help? Not just the restroom, but for pain medications? Or do they just sort of sit in without asking for help? Or do they get up without asking for help? Those might be ways to assess cognition. Can they recall people they've met, or things that they had for dinner, or visitors they had in the evening? Again, needing to know what the answers are to those questions. And you might not necessarily get to this, but I think it might be worth, educating the nurse on maybe some functional ways to assess vision. And this could impact their safety walking and navigating the room. This could be their safety, if the nurse is administering medications, their ability to read the labels of the medications to make sure that there's that reconciliation of medication before the client takes it. So it could just be making sure that they have their eyeglasses. And not just eyeglasses, but maybe do they have contact lenses? And do they prefer contact lenses versus eyeglasses? And are they able to access those things? So that interprofessional collaboration. And remember, from the MOT OTA perspective, the MOT might be doing, will be doing the formal synthesis and interpretation of the results of the functional assessments. However, the OTA is using their occupation-based analysis and their skill of observation to provide more data to the MOT and to the nurses. It's within everybody's scope of practice to do education. So having that dialogue and opening up the channels of communication between all disciplines. And then, of course, from our perspective, listening to nurses, they have a wealth of information that we might not think about either. So when you go and you provide your cognitive screen and they do their Snellen test education to you, having that open communication. I think that will be really helpful. So I hope this helped, and I will see you on Friday.